She came with symptoms of episodic low mood, irritability. She mentioned that it usually occurs about 10 days before her period start, and about 1 or 2 days after the period begins, the symptoms disappear.
Hi, I'm Dr. Dhanvanti and you are watching Anatomy of Bias.
So she's a 30-year-old female. She's a mother of a 5-year-old and stays in a joint family with her in-laws. And she mentioned that it's very, very disabling. She feels very overwhelmed, out of control. And the anger that she experiences is so much that on one occasion, she happened to kind of take it out on her 5-year-old daughter. And she ended up pulling her daughter's arm really harshly. And then she came for treatment. So she had come without anybody in her family. And she's been suffering from this for more than 8 years. So you can imagine the distress she goes through. Her friend did tell her to visit a psychiatrist, but her family said that she needs to control herself better. She needs to just work on herself. And there is no such thing as a mental illness.
Was she able to realize that it was coinciding with her periods?
So it was not something that she realized. But as we spoke about it, she mentioned that she only feels it for some time in the month and she can't understand what it is. And we kind of correlated that when her period starts, and that's when we realized that it's usually 10 days before the period. And once the period starts, in 3 days, the symptoms stop.
So Dr. Neha, how much of this can be attributed to a mental health issue and how much can be attributed what we very conventionally in society say it's hormones?
So what she has is very, very typical of what is PMDD or premenstrual dysphoric disorder. When we talk about hormones or we talk about mental illnesses, the brain is a part of the body, okay? And hormones have a very big effect on the chemicals in the brain as well. One of the etiological causes for PMDD is that the change of estrogen levels and progesterone levels during a certain phase in the menstrual cycle leads to an effect on something that's called as serotonin. Now, serotonin is the chemical in our brain who controls concentration, mood, anger. If that hormone is going to go up, down, which is natural, and a person has kind of increased sensitivity to it, is going to experience all of these symptoms.
How many people are aware of PMDD even amongst medical professionals?
I don't think many people are. There have been a lot of gynecologists, thankfully, who do get in touch with me and ask me what this is. Okay, so there is some kind of awareness, and most people know about PMS. Okay, and PMDD is a very severe form of this. All right, but the awareness is really not there. If you think about it, in India, menstruation itself is so taboo, right? We don't talk much about it. We take sex education workshops for kids in schools. And when we do talk about menstruation, everybody has this belief that it's impure blood that comes out. Okay, and everybody believes that it's something to kind of not talk about or is really not spoken much at home. Right? And think about it, then something else comes in, which is a mental symptom. All right, then it becomes even harder to accept.
Absolutely. So as you say, menstruation, I mean, religiously, people are not allowed to attend functions during their periods. When you buy a sanitary pad from a shop, he'll wrap it up in lots of brown paper and newspaper and hand it to you like a secret gift. And if ever you're walking on the road and you've accidentally stained your clothes, people will, like snigger and shudder and kind of come and whisper in your ear that this is what's happened. So apart from the fact that there is very little awareness from the side of the patient, the family, even other medical professionals who possibly could have helped her earlier on, it did take a long while till this patient finally got diagnosed and got the treatment that she required.
And the funny part is that for PMDD, the treatment is an antidepressant, especially a class of antidepressant which is called as SSRIs. Now, usually for PMDD, these are given episodically. Okay, so the SSRI treatment would start 15 days or 15 days into your cycle and continue up to the menstruation. Okay, till the periods start, and then we can stop it. And once we started her on this treatment, she came back, and she came back with her husband this time. And she was just like, it's magic. I have experienced magic. She couldn't believe the kind of relief she had from her symptoms. She still had a little bit of emotionality. She still had a little bit of crying intermittently, but all of her other symptoms had resolved. So it was like, it worked like magic for her.
All right. And may I ask you to describe one line or an aspect of this case that shocked you?
Well, that shocked me was 8 years. 8 years is a really, really long time. And the kind of symptoms that are there, I can't even imagine someone episodically suffering from that much anger or that much emotionality.
Okay. And was there a lot of guilt in this girl because she knew that she was experiencing something and nobody was sympathizing with her, so she might have thought it was all her fault that she was feeling this way?
She felt extremely guilty. And she definitely thought that it's something that's wrong with her, something that she's done, something that's wrong with her just as a character flaw.